I'm a whole new person. I have a whole new life. I want to go out now. Before, I wouldn't leave the house because I thought everybody was staring at me. And now I'm like, let's go, let's get out, let's run around the track.
I struggled with my weight for pretty much my whole life. I didn't think it was possible, to be honest with you. It's been life-changing, absolutely life-changing.
Even something as simple as walking up and down the stairs has been a world easier. And, like going to a restaurant, like being scared to be a little tight in a booth, it's not there anymore, even being 3 weeks out.
What keeps me going and doing what I do, the results that I get.
Bariatric surgery is weight loss surgery, and these are operations that have been developed over many years to affect the metabolic system in the GI tract and the way we metabolize food.
So what we do is basically reduce the size of the stomach, which in turn changes the physiology, reduces how much food you can eat, reduces your appetite, and changes metabolism. So it basically helps you to lose weight and maintain the weight loss long term.
So there are other options such as medication, diet, but among all the options, the most successful is surgery. And so it's found to have the best outcomes, both short and long term.
There are a lot of different weight loss operations out there in the world today. The most common one that is done now is the gastric sleeve. I would say number 2 is the Roux-en-Y gastric bypass. With gastric sleeve, it's a restrictive operation, so it limits the quantity of food that you can eat at one time. So rather than eating large meals, you're eating frequent small meals throughout the day.
And then the gastric bypass, which is essentially rerouting the intestines to allow you to absorb a little bit less of the nutrients that you would normally be taking in.
For the patient to qualify for weight loss surgery, they have to have a certain BMI, and BMI stands for body mass index.
When you have a BMI of 35 to 39, we have to also show that there are other comorbidities present. This includes acid reflux, sleep apnea, high blood pressure, diabetes, high cholesterol, chronic joint pain. And then we're able to get people approved for weight loss surgery. Once your BMI is 40 and over, you are automatically a candidate. So one of the most common weight loss operations that was done for a long time, and I think people are very familiar with, is the lap band. And this was very popular a few years ago. And essentially what we found was the amount of problems that it caused were a lot more than the problems that it helped.
A number of years ago, these operations were done in an open fashion. With a big incision, patients would have a lot of pain, and the recovery would be very, very long.
Minimally invasive using smaller incisions, it means less pain, quicker recovery, less chances for complications.
Robotic surgery is a fairly new field of surgery. It's really been blossoming over the past 10, 15 years or so. And it's basically a tool used in minimally invasive surgery. We are able to control the robot to perform the surgery with a little bit more finesse, fine motor control, and to get better results with that type of surgery.
So you're looking for surgery, you want to make sure someone knows what they're doing and that they have the proper abilities to take care of you, and that's what accreditation does. It makes sure we have not only just surgeons, but a whole team of people. You have nutritionists, dietitians, a bariatric supervisor, and then the accreditation is a process that comes in and reviews all that to make sure we're doing that. So when you're at an accredited center, you know you're getting the best care.
The bariatric surgery in general is not just your surgeon. You're meeting with a dietitian, you're meeting with medical weight loss specialist, you're meeting with our bariatric coordinator. All those different parts have to come into play. And at certain other centers, those parts don't exist because they're not requirements.
The accreditation process is a tough process. They have to make sure that the hospital is doing the best they can to get the best result. When the patient comes to my office, I sit down with them, I give the patient my advice, and they are the one who will pick up the procedure they want.
First of all, we have to make sure that you are safe to have the surgery. So you probably will have some imaging studies, some x-rays, you will have to see a cardiologist maybe, depending upon your situation. We make sure that we are doing this safely.
We make sure if you have any other medical conditions, they're taken into account. There's psychiatric counseling, there's nutritional counseling, and all these kind of come together to make sure someone is ready and prepared for the actual procedure.
From the time of the consultation to the time of surgery was about 4 months. I had to do nutrition classes with their on-site nutritionist, Lisa, who's amazing, by the way. I learned so much from her. She really makes sure to set you up with all the tools you need to be successful and really start applying the procedures before you even have surgery so you know what to expect after the surgery.
My pre-op process, seeing my nutritionist, seeing Dr. Stevenson monthly, really helped alleviate anything that I had come to mind, any questions.
The procedure itself is usually about 30 to 40 minutes. So it's very short time, it feels like nothing for the patient, and when they wake up, they're usually in their room upstairs.
I woke up from surgery and I was actually pleasantly surprised that I was not in pain. I was sore, of course. It was probably the easiest surgery I've had, and I've had a lot of surgeries.
The recovery was honestly a lot smoother than I thought it would be. I really didn't have much pain. It was just more so trying to get into the rhythm of taking vitamins several times a day, drinking water constantly, and really just starting the process of food, like learning my body all over again.
The main recovery process is kind of getting used to the diet. So after each of the different types of surgeries, there's different diet advancement protocols that we follow. And part of the challenge is kind of making sure that you're strict with that and making sure that you're able to stay hydrated given those diet limitations.
The reason for patients going home on a clear liquid diet is to allow the stomach to fully heal over time. These diets are in place for your safety.
We also have an Inspira support group meeting for patients who had the surgery. We have groups for new patients, or we call it new graduate, and groups for old graduate, meaning patient from 1 to 5 years and 5 years and longer. And it's done every month, and it's free.
Bariatric surgery is really an amazing opportunity for a surgeon to change somebody's life.
I feel great. I am energized. I feel sexy, where before I did not feel sexy.
It's not only about what you lose, it's about everything you gain with this surgery.
I've never lost more than 50 pounds in my life. I was on every diet imaginable. But when I started losing weight, I said, I can do this.
Patients like Shelley sought out this operation and this program because she was already motivated to make the change in her life. So she continues to maintain a healthy lifestyle, stay active, and continue to eat right. We're very proud of her.
Every single patient I did weight loss surgery for them, they said if they have to do it again, they will do it in a blink of an eye.
If you are suffering from obesity and you are concerned about your weight, please call us.